Welcome to 24 KEIRUS. I'm Kelly Johnson, founder and CEO of KEIRUS by KJE. We are week 3 of a series on mental health awareness, and our guest is Brittany Cannon, an LPC who has practiced privately as well as within corporate environments. I'm personally learning a lot, and I hope that you are too. We'd love to see your feedback about this series and others, so be sure to comment and let us know. Brittany, welcome back.
Thank you.
Thank you. I think today let's talk about the stigma of mental health, because so far we've talked about like why it's important and maybe some even things that we can do as individuals to help support mental health. But we have to address the elephant in the room when it comes to this topic that, you know, there's a lot of stigma and stereotypes around just mental health. So what can we do on an individual level and even organizationally to help overcome that?
Sure. I think it's being careful about what we say. We've all heard the term thrown around, she's bipolar, the weather's being schizophrenic today, which is an improper analogy, but that's on my mental health horse, right? But we all hear these things, right, thrown around just daily. And when an individual struggles with that diagnosis or diagnoses, it's not a joke, right? And I think that because we tend to throw those terms around, oh, I'm depressed, and you may be, but is it because, that emotionally you're depressed, or you're depressed because something didn't go your way, right? And that's your response, right? And I think, again, continuing to talk about it and share experiences, it's nothing to be afraid of from people because, ADHD is a mental health diagnosis. Being on the autism spectrum is is a mental health diagnosis. All of these things, right? Substance use is a mental health diagnosis. And so I think that we don't really understand anything that affects the brain is mental health. Mm-hmm. And so I think having those conversations around it, and it's not anything that we've done wrong. It's a chemical imbalance in our brains. And we would treat diabetes, which is a chemical imbalance in our body. We would treat high blood pressure in the same way, right? If we had, if our leg was broken, and maybe it's not a long-term thing, but for right now, this is something that's really a struggle for me to deal with. And put it in those terms, right? If we would do the same for our physical body, why not for our mental health, right? And our mental health impacts all of our body, right? If I'm not functioning properly mentally, then my blood flow is not the same, right? My nervous system is not the same. My cognitions aren't the same. And so I think that just having these conversations, my family probably gets sick of me because they, I'm always correcting them. She's, I don't know if they're schizophrenic or something. I'm like, no, absolutely they're not. And it's not a joking term, right? Yeah. And I'm like, and the technical term would be. And I think that it's making sure that we open that space to, one, have the conversations, to not judge, to give grace. I have a friend that struggles with bipolar disorder and goes through her phases, right? And there's been conversations where she's told me she wants to kill me. I know that that's not, right, who she is. And then has had to come back and apologize to me. And that shame, she's like, I thought you wouldn't want to talk to me again. I'm like, no, I love you. I know that that's a struggle. I can't imagine. I'm just glad you're doing better, right? And so I think, and understanding too, it can be a lot of trial and error in medications. So giving people the grace to figure it out, and not being judgmental, not being accusatory, something's wrong with you. Get yourself together, right? You need to go see somebody. Well, that sounds very aggressive and very condescending, right? And so how we say things And the love and compassion that we say it with is really important. But I do think that, you know, as far as the stigma, I think conversation, because we're seeing people come being more open, being more expressive. But it's still really hard. I think it's one of the most, you know, difficult things for people to talk about. You'll hear people say, "Oh, my sugar's high," you know. You don't really hear people say, "Oh, my serotonin levels are off today," right? And so we don't just throw around those terms, but I think it would be amazing if we did.
Yeah.
You know, and part of that is being in touch with our feelings and our emotions and what is going on internally. I think we are in this "I'm fine" society, right? We ask how you're doing, but we don't really want to know. How's your day going? We just want you to say, "Oh, it's great," and keep it moving. We don't really want to hear the answers. So I think reducing the stigma is having those conversations and slowing down the energy so that you can really engage with someone and connect to see if they really are okay.
Yeah.
Yeah.
Man, okay, you've said a lot that is like so good. One of my quick kind of observations is you're encouraging us to really pay attention to our feelings. That definitely makes sense. But I'm thinking about in the workplace, we're told not to feel.
Right.
We're told not to talk about our feelings for sure.
Produce.
Right.
Yeah.
And so you spend the majority of your time at work. So the majority of our messages are don't pay attention to how you feel, just do your work, right? Just perform. On top of the stigma, the taboo, and the insensitive comments and jokes that we make,
Sure.
right? So I love, it does start with education and conversation. So I love what you're saying about that, and even just being more aware of, like, it's not okay to use that as a jokey term, because I think we've learned what language is not inclusive for some areas, but not, like, I think mental health it's kind of a frontier, like a new frontier for a lot of us.
It is.
So
It is. And it takes a lot of courage to open up about you being atypical, right? Out of what is considered the norm, right? And your functioning. And I think it's just hugely important because we're seeing the prevalence of what happens when we ignore it and what happens when we don't take care of ourselves. Suicide has increased, mass shootings, right? There's this conversation about their mental health afterwards, right? And that's the wrong time to have the conversation because afterwards, yes, it does work, right? But what if we're proactive instead of reactive in our processes and our engagement with people? I think there should be more funding, right? Mental health is lowly funded. It can be hard to attain. It can be hard to find a psychiatrist. It can be hard to, what are the steps, right? What's the difference between a psychiatrist and a therapist? I get called Dr. Brittany all the time, and I'm like, no, I can't prescribe medications. What is therapy, right? People wonder, well, what am I going to talk about? And then you go and you just talk, right? It's not this, they're not analyzing you in that way or picking apart your words. Their role is to help support you and help you make those connections and meanings so that you can flourish, right? And move forward in life in those places that you're stuck in.
yeah. And I mean, you've helped me personally also just see the importance of, or have a different perspective about medication, right? Like what you said about, if someone has diabetes, high blood pressure, which are very common, very prevalent, no one really questions taking medication for that, right? And really just recognizing that there are imbalances in the brain, and those imbalances impact other systems in our body as well. So we're doing more harm by not seeking kind of different therapeutic remedies. There's something you just said that I wanted to kind of tap into a little bit more. Oh goodness, I lost my train of thought. But I think just talk a little bit more about how we can move beyond the stigmas to get help. What can what could I do if I see someone who is struggling? Because you're right. Like after the mass shooting, it's a little late.
Yeah,
It's a little late.
absolutely.
So
Absolutely.
maybe help us, those of us who feel like, well, I'm nobody. What can I do? Maybe help us have some tangible takeaways.
Yeah, for sure. And I think even what you said, Kelly, like just with the diabetes and the high blood, we're expected to take medication, right? If you don't, there's this thought of, why would you not?
Right.
Right. And so, but there's not that same, it's the opposite with mental health. Individuals tend to think that I can just get over it, right? And I'll muscle through it. But you wouldn't muscle through high blood pressure or, high cholesterol, things of that nature. So I think that getting involved, right? Looking for signs, I think we miss a lot because we're in our cell phones, we're on our computers, we're not engaged in people. We don't see necessarily some of the same things that we used to see in the past, right? Because we're not as connected as a people. There's not a picking up the phone and calling. It's sending a text and, it's a 40-character tweet, And so we're not really engaging with people. We want to give them a minimum, but not connecting. And I think finding, if you're a social media person, finding mental health resources so they come up on your phone, right? Finding things that have quotes about mental health and development and growth so that you're tempering some of those things that the shopping, the music, the this, the that, right? That don't really feed your soul. Incorporate some of those things so they come through in your feed as well, right? And a lot of times we'll find that, that sparks a thought, right? Maybe I don't necessarily do anything with it, but it sparked something. And I think that if you want to get involved, I think there's so many ways to, right? But I think the first way to get involved is checking your own mental health, right? And taking those steps for yourself and doing what needs to be done just to make sure you're in your best place. It's to me, it's no different than working out. Right? It just builds those muscles. It builds that mental capacity for certain situations and develop health, right? And develop healthy responses and boundaries and all of those things as well.
Yeah, that's so important. And I think, just to get on, to get on a little bit of a soapbox, I think my frustration with the stigma, it's bad enough that there's a lot of stigmas around mental health, but I think our healthcare system, doesn't help make it easier.
It doesn't. I agree.
It's there's some even kind of EAP programs where you can't even choose the person you talk to.
Sure.
Right. And so, but I can choose my primary care doctor,
right?
But I can't choose my mental health provider. And so I think, unfortunately, we've got a lot of flaws.
We do.
In the systems that are supposed to help us. Sure. Healthcare plans don't limit the number of doctor's appointments you can go to about diabetes.
Right.
Let's just start there, right? Like counseling sessions, there's just a lot of limitations on the type of care we can seek. So I don't want you to have to say anything about your industry that, but that's just one of my personal frustrations and what I've seen.
I agree. It's not easily accessible, right? And then it can be hard to find. I want someone that I can feel like I can connect with, right, as an individual. And so, but I think that we get into a mode, you can still connect. I can still connect with a white male, right? I can still connect with a Hispanic male as long as they understand, right, what I'm going through. And so I think, too, it can be, I tell people, and this is an interesting analogy, it can be like dating, right? Finding the right person to connect with about your mental health. Like I might think my therapist is great and you might think they're terrible, right? Well, I might think your husband is terrible. I think mine is great, and those things, right? So there's someone for everyone. Don't just get stuck on, I went once and it didn't work, right? Because we go to restaurants, we'll try it again. Maybe we didn't like it, but we'll try different things again. Again, it's finding that person that's for you. And it could be the one that you least expect.
That's true.
Right? And so just taking that opportunity to try people out. And that's fine.
Yeah.
That's fine.
Just keep trying. That's
Just
the
keep
most
trying.
important thing. Yes.
Just keep trying.
So good. Awesome. All right. This has been a really good conversation about mental health, things that we can do to minimize the stigma and the stereotypes, the negative stereotypes associated with mental health and wellness and well-being. This has been another episode of 24 KEIRUS, where we help you live out your commitment to diversity, equity, and inclusion. Be sure to share this episode. If you care about people, this is such an easy way. Brittany has already shared with us. Do something on social media. This one episode could really help someone that you don't even know about. So thank you for doing that. Thank you for taking the time to care about those who are around you. And until next time, we'll see you soon.